Hey everybody, thank you for checking out this video. In this 5-minute or less video, we will focus on step 1 of the evidence-informed process, asking clinical questions. We will review why it's an important aspect of the evidence-informed process, discuss the PICO framework as a tool to help us to generate sound and searchable, clinically relevant questions, and we'll conclude with an activity designed to help you become comfortable with applying the PICO framework. This week's participation activity also provides an opportunity to apply the PICO framework and to develop your ability to frame clinical questions that are relevant to any patient population. Are you ready? Oh, and as always, I'm trying to do it in 5 minutes or less. As you reviewed week 3's content, you may have questioned why we need to bother with learning about the research process, particularly if our primary role as nurses in direct practice is to use research-based evidence in support of our practice. What does knowing how to ask a question have to do with evidence-informed practice? Well, the answer is twofold. First, we can't determine if evidence is useful to our practice if we don't know its quality. And so by quality, we want to be able to say, okay, this evidence that we have is good, it is reliable, it is valid. And we can't determine the quality of the evidence if we don't understand how it was and should have been generated. And the first step to generating research knowledge is to ask questions. Although as a practitioner it is unlikely you will be conducting research, similar to a nurse researcher, your search for information from practice is also converted into focused, structured questions that are the foundation of evidence-informed practice. For more information about the differences between clinical and research questions, refer to page 66 to 68 of the text, Nursing Research in Canada, 4th edition. Now, clinical questions often develop from situations in practice for which there are no ready-made answers. One of the first things you will need to decide when a question arises from practice is it a foreground question? That is, a question which directly links to a patient situation, the answer to which will inform your practice decisions or actions. Or is it a background question, a who, what, when, where, why, or how question that relates to basic information and often answered with general knowledge readily available in sources such as a textbook. For more information on background or foreground questions, check out the 5-minute or less video on the topic. Now, developing a focused clinical question is important because it forms the basis for searching the literature to identify evidence. Focused clinical questions have 5 components: population, intervention, comparison, outcome, and time. These 5 components are referred to as PICOT, and they form the format from which questions are developed. So evidence-informed practitioners often use the PICO framework to search for questions in literature databases. It's important to know that PICO isn't the only game in town, and in the article by Cook, Smith, and Booth, 2012, they discuss other alternatives to the PICO framework to help develop clinical questions and searchable questions. These authors highlight that PICO is well suited for research questions that seek to make comparisons, but it's not optimal for questions about understanding and exploring an event or experience at greater length. So they suggest the SPIDER framework. So later in the semester, we will discuss using SPIDER to pose qualitative questions. So the elements of PICO, as I said, are the same as the elements of a clinical question. So the P is the problem or the population. So what are the patient demographics, age, gender, or what is the problem type? Intervention is what intervention is being considered. For example, some medication, exercise, rest. Comparison and control. Is there a comparison treatment that's being considered? There always is. Doesn't have to be, but typically when you're looking at trying to figure out whether the intervention or the independent variable is affecting the dependent variable or outcome, there's often a comparison. And of course, the outcome is what we would be the desired effect that we'd like to see, and what effects that we don't want to see. Now, when forming PICO questions, it's important to keep a few things in mind. Your population or your patient is part of a population. And so, in addition to gender and other things like age, you want to consider their ethnicity, socioeconomic status, maybe other demographic variables. As I said, there are aspects of PICO that are not used often or can be eliminated. That includes the C, comparison, or the T, the time. Outcomes, the independent variable, should be measurable as the best evidence in quantitative research comes from rigorous studies that are statistically significant findings. And lastly, the outcomes ideally measure clinical well-being or quality of life as opposed to just things like lab values. All right, last slide. Let's break down the steps of asking a clinical question a little bit further. Now that we have reviewed the key aspects that are important to know when we're framing a PICO clinical question, let's pull the steps together. So one, we have to determine if the question we're interested in is a background question or a foreground question. If it's a foreground question, then we can start to talk about and break down what the PICO elements are. Lastly, we can just construct our question by bringing together those PICO elements. And I always suggest that if, as a beginner, you use a template that will help you craft your question. So in the course, we've identified a number of sources, and underneath this video, you will also see a few links to some templates that are available online. All right, just to finish off the video, I've created a simple activity for you with 3 parts. The first 2 parts, you're going to identify the PICO elements from a PICO clinical question. The last one, you're given the elements and you have to write the PICO question. So pause the video, do the work, play the video again, the answers will appear, and you can do that for all 3. All right, catch you in the next video.